Participants are here. Welcome. Welcome to Solcere. I'm Dr. Heather Sandison.
And I'm Dr. Mana Sembi.
Thank you so much for joining us. We're here to introduce Solcere and to share a little bit more about how we treat dementia patients in the clinic and what we've learned so far through the clinical trial that we're conducting here at Solcere, North County Natural Medicine. So recently, we've been in the process of rebranding from North County Natural Medicine to Solcere. And we did that because Dr. Sembi and I are creating this new brand and this new clinic together. And we felt like this represented more of what we're doing. So the word Solcere comes from soul, as in sun, and also as a sort of shorthand for solutions. And the way that we think of Solcere, sort of the cere or the cerebrum, the brain, it's like light shining on the brain as we learn more about dementia, what causes dementia, and some of the things that can help us really create healthy, well-rounded brain health. So we also, we're excited about the name Solcere, and also the logo here represents the peaks and valleys of life, sort of the flow and the path of life and all of the things that fill it, our families and our friends, our experiences, our health, and our jobs, our contributions. And so this kind of flow and this path that we feel privileged to join you on is what's represented here in our new logo. So thank you again for joining us tonight. We are coming off the end of the Reverse Alzheimer's Summit. And if you haven't checked that out, there's a ton of great interviews with experts, including Dr. Dale Bredesen, Margaret Christensen, Dr. David Hasse, Felice Gersh, people who I've really looked up to, learned a ton from. And I am really excited to share those interviews with you because I know that you'll learn as much from them as I have. Some of the key takeaways from the summit included just this resounding agreement amongst us, amongst those of us in the conversation about reversing Alzheimer's, that although we always want more data, we always want more science, the time to act is now. We don't need to wait for more data to take action to reverse dementia. That enough of us are seeing over and over again that this is possible, that Alzheimer's is reversible, and it's certainly preventable. And so we can't wait to have you or your loved ones, whoever you're considering having come to the clinic, join us on this journey to reversing Alzheimer's, be one of the miracles, one of the pioneers reversing this absolutely awful disease. We know that just in the past 10, 15 years, while cardiovascular disease and deaths from cardiovascular disease are going down by 7 or 8%, the incidence of Alzheimer's has increased by 145%. So Alzheimer's is sharply on the rise. We are understanding that this is a multifactorial problem. This is not a one-size-fits-all sort of treatment. This is very much an individualized, comprehensive approach where we get reversal, where we get results. And so the shift is definitely happening even in the neurology community. People are starting to understand and appreciate that it's probably not just going to be one drug, that there's going to be a combination of lifestyle factors, different interventions from functional medicine, and then potentially some medications that help here and there. But really, this is a lifestyle disease, and we need to treat it as such, much like we treat diabetes or heart disease. And so it's exciting to see so many of us getting on the same page after I certainly was told when I was in training, I don't know if you were, that there was really nothing we could do, and that to suggest otherwise was to offer false hope. We know now that that is factually inaccurate. There's lots we can do. So we're going to talk a lot about that tonight. So I was very fortunate. We were very fortunate to be awarded a grant in 2019 to study what I was seeing clinically, which was that reversal of Alzheimer's was possible. So in 2019, we got the funding, and then we went through an IRB, or an internal review board, looked over the trial, and just what their process is to make sure that no one's being taken advantage of. Whenever they're human research subjects, they want to make sure that no one's going to suffer unnecessarily or be put in some sort of position where they're being taken advantage of. So this was very much inspired by my training under Dr. Bredesen, and then what I was seeing clinically with the reversal. So we included quite a few people. Our exclusion criteria is not all that broad. So we're taking participants who have MOCAs down to 12. So a MOCA is the Montreal Cognitive Assessment that we use for anyone who is suffering with dementia. And a normal is over 26. Really, that's a little bit arguable. Really, you want to be at a 29-30. It's on a 30-point scale. And if you're not there, then there may be some cognitive impairment. By the time we get to mild cognitive impairment, this is like saying that you have like stage 3 cancer. This is right before full-blown Alzheimer's. This is not okay. And this doesn't mean come back in 6 or 12 months. This means we need to get started right away. Some of the incredible things that we've seen include, quick reversal with people who are younger. So when we put the trial together, it was very much based on what we saw working. We got IRB approval, and we did it in 2 chunks of 6 months. So the first 6 months is very intensive, and we'll talk you through how that goes. And then the second 6 months was to kind of see what happens when people are left to their own devices. So after they're out of this intensive part, if they stay on the trial or stay on the protocol or kind of fall off of it, go on vacation, go back to their old habits, do they continue to improve? Do they go backwards? What happens to the disease progression after that first 6 months of intervention? So we're excited to dive into this with you. Hopefully that gives you a little bit of context of why we recommend the type of protocol that we do. So the first visit is a baseline visit. This is where we're collecting a ton of data, both with the doctor and then the lab draws. So we're looking at blood, stool, urine, hair to understand all of the factors, all of the ones that we know. We're constantly looking for more of them. All of the factors, whether they're genetic or toxic or hormonal imbalances, all of these things that may contribute to the cognitive decline process. What have you gotten out of some of those initial visits?
Yes, the initial visits have been very, very helpful. I think the patients are beginning to understand that the drugs that we currently have for Alzheimer's, all they do is really slow down the progression by just a marginal rate. It doesn't make a significant difference. So basically what we're saying is if the normal rate of decline was, let's say, 20% a year, and I think we have statistics for that. So let's say if the decline is 20% a year, if you take a drug, the latest drug, which came out, I think a year or two ago for Alzheimer's, all that does is it reduces the rate of progression from 20% to, let's say, 15% a year. The decline is still taking place, so which is why we are saying that there is no need really to wait to, like, if your family history is one that there is some dementia or Alzheimer's in there, or if you know your genetics already, or if you feel there are some metabolic issues, some hormonal issues, there might be issues with toxins and other things like that, we urge you to start the process early in your 40s and 50s. Don't wait until the onset of dementia to start to address it with your loved ones and yourself. So we really encourage everybody to take action proactively, because prevention is so much better for the patient and the families than having to reverse it, although we have excellent data that we are able to reverse it also. So talking about the protocol, as you said, at the first visit, there is the baseline with lab collection. And what we are seeing is, depending on how progressed the patient is, if the patient is pretty far along progressed, and of course they come with a caregiver because they're not able to give us their history and their medications and the supplements, all that correctly themselves. If it is still in the beginning stages, then they're able to come in and we do all the tests like Dr. Sanderson was saying about. We do the MOCA, which is a cognitive assessment on a 30-point scale. We do other tests like it's called VAVI, I forget what it stands for, but anyway, it's kind of an imaging, like an EEG of your brain, and we take it at the beginning And then we also take it through the process to kind of monitor your progress. So at the first visit, of course, it's a comprehensive intake and we do labs. Then a month later, we meet for a lab review, and then we interpret those labs and we make an individualized treatment plan. Each patient's plan can be different based on what is the etiology that is most concerning in their case. So in somebody's case, toxins might be a bigger burden. In somebody else's case, an infectious burden might be more problematic. So we see which way we have to address. And then again, we do a check-in a few months later just to see how, if there are any questions, how they're doing, are they able to continue with the diet, stay on top with the health coach, especially through this protocol with the study. We have regular visits with the health coach, which is very, very helpful to all patients. And then 3 months after they start their protocol, or is it 4 months, at the 4-month blood draw, we do the labs again to kind of see, is there any movement yet? And then a month after that, then we meet again to check the labs and adjust any treatment plans.
So you'll start to notice a pattern here. Essentially, we expect about 12 weeks to show significant difference in the lab work. And typically, we expect patients to be reversing their dementia within about 6 months. If they're not, we're probably missing something. And so we're tracking this, we're measuring at regular intervals. And that first visit we call baseline, and then it takes about a month to get labs back. So you'll see a lag here in our pattern is that we sit down at baseline, collect a bunch of data, do a very thorough intake, and then we collect the lab work at that time that takes about a month to get back. So then when we sit down a month later, we get an individualized treatment plan. There's a lot we can get started on day one, but a lot of the nuances of what Dr. Simbi was explaining of, for you, is it more hormones or is it more toxins or more infections or more traumatic brain injury? What is the path that you took as an individual to arrive at this dementia diagnosis, at these symptoms? And then we start to work our way backwards, unraveling those things and healing those things. This can take, we're getting, the longer people stay on the protocol, we see this at Marama, we see this in the clinic, the longer people stay on the protocol, the more comprehensively they do it and engage with it, the better the outcomes. Now, we also, I don't want to limit anyone. I have this conversation with my colleagues all the time of, somebody will say, well, we need to be more specific, or we have to have health coaches involved. Don't let complexity stop you. Just get started. I can't tell you how many people have just read Dr. Bredesen's book, and that helps them alone. They're highly motivated, they have great support from a caregiver, or they're early enough along in the process that that's all they need to do is take that information and run with it. Many people, by the time they get here, they've tried that for a while, and we need to fine tune and figure out what is it that's preventing them from getting the health that they're committed to getting. And so we go through this process. Baseline, 1 month lab review, 2 to 3 months we like to check in, because there's always something that comes up there, and it's helpful to just figure out, what are we missing? Did you get all the medications? There's all kinds of little symptoms that come up. Oh, I wasn't sure about this, I didn't know about that. So it's nice to just get on the same page again, make sure the process is going. We also notice in that first month or 2 or 3, sometimes there's a little bit of a hump to get over, where you're detoxing from sugar or alcohol, learning to exercise again, maybe not spending as much time in front of the TV, and that these lifestyle changes, they take time and it can be a little uncomfortable, but it's worth it. Hang in there, it's worth it. You will see the results. So then at 4 months, we do the blood draw. 5 months, we get back together again. You and your doctor sit down and we adjust the treatment plan based on this data that we get. So we get your feedback, how you're doing. We get your caregiver, if they're involved, they get to tell us how things are going, what's feasible, what's doable, maybe part of the protocol isn't. We get to streamline and strategize, and then also respond to the feedback we get from the labs themselves. So then as we continue along the protocol, where are we? Oh no. Okay. As we continue along the protocol, at 8 months, we do another lab collection. So we've done it at baseline, and then it's usually around 4 months. And then again at 8 months, we're doing another lab collection. That's 12 weeks after we've sat down to review that 4-month lab work. So this is a little confusing, but hang in there with me. We essentially wait 12 weeks to get that feedback from the labs to make sure that they're responding to the interventions that we have you doing. And then at 9 months, we sit down and we make the necessary adjustments to the treatment plan based on that lab work and your feedback. Again, we collect those labs at 12 months. And at 13 months, we sit down again and then make some changes. At this point, you should be going into more of a maintenance phase, and we expect to see results. If you are committed to the process, if you're doing all the work, we can give you the advice, but really this protocol works best when it's implemented as fully as possible. And we understand that takes a lot of work. So we're here to be supportive, and we recommend partnering with a health coach. They can do the check-ins more regularly and really help to troubleshoot some of the things that come up. By 12 months, by about a year in, we should be seeing very significant results. And this is always a cause for celebration. So Dr. Sempe is going to take us through a lot of the questions that we ask, a much more comprehensive dive than most people are used to going through with their doctor.
Yeah, thank you. So in the initial intake, a lot of the questions that we ask focus on the status of your digestion. How is your gut health? What is your diet? We ask about what you have been eating, what you have figured out that you need to avoid. Are there any foods that you're allergic to? What do you typically like for snacks and desserts? And how much water you're drinking every day? Do you take coffee or juice, alcohol, soda intake? All these things are important for us to understand what your habits have been. And we also ask about a smoking history and status, as well as any other medications, drugs that have been used or abused that have been used in the past. It just is helpful for us to know. We need to know if you're getting some exercise, and we typically like to ask, what was the amount that you got in the last week? Because if you're consistently doing it, then your last week's picture would show us that. Another very critical piece of this puzzle is the sleep, the amount of sleep and the quality of sleep. So we ask you, what time did you go to bed last night? What time did you wake up this morning? Did you wake up rested? Have you ever done a sleep study? Do you have any reason to think you may have sleep apnea? Has a partner told you that you snore, or any sounds in the middle of the night? Or has anybody witnessed you kind of like pausing between breaths, which may give us cause for concern? So that's an important piece to consider. Again, and then hormones for men and women. We check your hormone status to see where things are, and if there is need for the hormones. There is a lot of misunderstanding and misconception around the use of hormones. And a lot of women, even today, are not taking bioidentical hormones. Either they may not be taking them at all, or if they're taking, they're not taking bioidentical. So there's a lot of work and education that we do around this topic. A critical piece of the puzzle is stress. What is your level of stress on a scale of 1 to 10, 10 being the maximum? Where is it coming from? Is it from relationships? Is it from work, from finances, from home, other reasons, whatever that may be? It helps us understand you and your life better, and helps us tailor our suggestions to what will work best for you. Then we ask about the various kind of exposures, your dental history, if you've been exposed to water damaged buildings, which gives us a strong suspicion for mold, what kind of, and how often you consume fish. So that gives us concern for mercury exposure. If you have lived in old buildings, so we are concerned about lead and asbestos. If you live on or near a golf course, we are concerned about glyphosate and Roundup. If you live near an airport, or if you have worked in the defense services, the level of exposure in the armed forces is much higher than the average population. What kind of hobbies you have, if there's any reason to that you might be using some kind of substances that could be toxic in your hobbies, some kind of travel, like if you've traveled to countries like Mexico or India or Thailand, if you've had any gut issues when you've traveled, if you've lived overseas, if you've camped, traveled in the third world, especially if you have animals in the house, and especially if they're in bed with you. If there are animals in the house, and especially if they're in bed, you're definitely sharing the microbiome. So we need to be cognizant of what kind of parasites, if at all, might have transferred over. Your camping history, if you know where you've gone, what kind of infections, if any, you may have picked up, what kind of vaccinations you've had, if you've had any reactions to vaccinations, how frequently you've had them, any infections like strep or staph, even UTIs, recurrent upper respiratory infections. Herpes is a big one. A lot of people will have cold sores and others, so we want to make sure we address that. And the frequency of antibiotic use. We know now today that that can have a big impact on your gut. And finally, we need to know about trauma, especially head trauma. A lot of people have had whiplash or other brain injuries through sports. So we need to know that to see if there are lingering effects from that. They may not have been addressed that we don't know about. So we address that as well.
So as you prepare for the first visit with us, there's a few things that you can do to get the most out of that visit. We understand that you're making an investment of your time, your faith in us, as we take very seriously. And so if as we partner and work together, the things that you can do to help us best prepare is for you to be well prepared. So if the people I see do best in the clinic have a really strong supportive partner, and that can be a spouse, it can be a child, it can be a friend. We've seen people do well with pretty much, I mean, it runs the gamut of who that supportive partner is. But I see it over and over again that people with dementia trying to do this on their own, it is an uphill battle. It's a real challenge. It's not impossible. I don't want to suggest that, but it's much, much easier. And the rates of success are much higher when you have that person who can motivate you, take notes. This is a lot of complex information that we're sharing with you. It's a lot of history that you need to bring us so that we can give you the best advice. So we have two options for getting us your medical history. One, you can log into our Power to Patient online and fill out all the medical questionnaire. Two, if you aren't tech savvy, we get it, it happens. We have a paper copy of our intake form. So you're more than welcome to come in early. I do highly recommend coming in early because we want as much time with you as possible. And the time that we've set aside starts when your appointment starts. So if you're still filling out paperwork, that puts us behind and then we don't get as much time together. So having that filled out ahead of time is supremely helpful. We want to understand, have it printed out. It's always hard for us if you say, okay, I've got it at home. It's on my computer. It's in my phone. What we need is that copy of it. We want to see right in front of us, what are the medications you're on with the current dosages, even what doctor is prescribing them or managing them, which supplements you're currently taking, if you take them regularly or not. Drug allergies are absolutely paramount. We've got to know if there's any drug allergies so that we never in the position of prescribing or suggesting something that might be harmful to you. I love to know who else is on your team. Are there specialists? Do you have a cardiologist? Are you seeing them? If so, why? Do you see them regularly? Oncologist, have you had a personal history of cancer and there's somebody that you're following up with annually, even if you don't have a current cancer? We are not primary care providers here. So we highly recommend that you are established with a primary care provider, that you have a good working relationship with. We like to partner with them and make sure you have someone on your team who's on call, has hospital privileges. You have someone there to support you from that perspective. Any insurance information, we don't take insurance for the visits. However, often Medicare will cover many of the labs that we run. So having that insurance information handy and with you the day of your visit is so important, particularly the day that you get labs done, because we need to submit that insurance information with every lab kit that goes out. So as I mentioned, that supportive companion is so helpful. And whenever I just want to take a moment to thank all of the caregivers. If you're listening here, if you've made the effort to, excuse me, I just am so grateful to you for your support. You do the hard work of caring for your loved ones, and this process wouldn't be possible without you. I see it at Marama, how challenging it is. And especially when it's a family member, it's hard not to take some of this personally when people are experiencing the disease process, maybe even personality changes. And I am so inspired every day by the caregivers and support that show up for our patients in this office. It is absolutely incredible. I want to be a daughter like the daughters I see, and hope I'm raising a daughter who is somewhat like the daughters that show up with patients in our office. Another important piece of this puzzle is, unfortunately, at this point, we are not covered by insurance. Not all of it is covered by insurance. Now, we are doing the hard work of the studies and collecting all the data that we can to change that. So we would love nothing more, and we don't think there's anything more valuable for insurance to cover than the prevention and the treatment of this disease as early as possible. And so, unfortunately, that's not where the world is yet. We are working tirelessly to get it there, doing everything we can. But at the moment, it's really important that you have the time and resources set aside to commit to this process. It's frustrating, I know, for all of us that this isn't better covered. And if it takes another 6 months to come see us because then you are ready to commit to the process and you kind of prepared in advance, that is probably the best way to go about it. It's just to be sure that you have the time and the resources set aside. I apologize, our slides are not advancing at the pace that we expect here. All right, so the labs. We'll do a quick kind of overview of these labs. We'll of course go into more depth. I want to make sure we have plenty of time for question and answer session here, so please start putting your questions in the chat. The labs I'll take you through now include what we call, I always refer to it as what your conventional doctor would do, but on steroids. So this has your complete blood count, a complete metabolic panel, of course, vitamin D, a very thorough thyroid panel with 8 markers in it, a hormone panel that looks at all of the different hormones that Dr. Bredesen describes, B12, iron, your ApoE status or genetic susceptibility, an ANA, we look for autoimmune processes that might be going on that might also hint at where the imbalances are in the system. Omega-3 levels, cholesterol panels. This is particularly important for ApoE4/4 or ApoE3/4 patients as well. We want to understand what your lipids are doing, and that is going to influence our dietary advice. So having this information is super important to how we get to the individual advice that we give you. Of course, liver function, kidney function is important because detox is such a vital component to this. What I've seen in my clinical practice through the trial, 100% of our dementia patients have a significant amount of toxic burden. So we're going to be addressing that at some point along the way, usually very early on. So we test that right away. Mycotoxins, I think of them like flavors of ice cream. There's 3 of them, the mycotoxins, the chemical toxins, and then the heavy metals. And so we want to understand each of those. It's important that we test them all because we treat them differently. If you have lead, we have one chelating agent. If it's mercury, we have a different chelating agent. Those are metals that are directly neurotoxic. Mycotoxins are also well-known neurotoxins. And so we need to understand what's there so that we can get it out as quickly and efficiently as possible. The stool panel is very important. There's a lot of times we have patients who have no complaints, no GI complaints, and have very abnormal stool tests. And that can be causing symptoms not just in the gut, but cognitively. And so we need to understand what's going on there. This also, of course, plays a vital role in how we absorb nutrients. And we need enough nutrients to support brain function. If we don't have enough B12, if we don't have enough fats, if we don't have enough proteins, amino acids or the backbone of proteins, these are also the backbones of our neurotransmitters. So these affect mood and cognitive function directly. So really important to understand what's going on in the gut. And then we can look as well at the nutrients. And we always want to understand if there's a big immune reactivity component. That we don't always treat first. We usually want to get the other things dialed and then come back and see if there's still a big immune process going on. But as soon as we know kind of big picture, then we can set up that path. How are we going to get to resolution of these things so that we can get to better cognitive function? So these are some examples of some of the lab reports that we get. You may have seen these if you've worked with one of us or with a functional medicine doctor. You may have seen something that looks like this. So again, this is like our panel, our conventional panel, but on steroids. We often run some of these through Cleveland Heart Labs for Vibrant America. And so this is an example of one of the pages from Cleveland Heart Labs. This is an example of a mycotoxin report. So you can see here that there's a graph showing things going up and things going down. This is so nice to see. It's really a cause to celebrate when we start to see all of those coming down. Once we can get rid of mycotoxins, it's nice. We can just kind of check the box and move on from there as long as there's no new exposures. This is an example of glyphosate or Roundup. Roundup or glyphosate, the active ingredient in Roundup, is a known neurotoxin. The highest levels of glyphosate I've seen on a report like this can get up to 5, 6, 7, and those are in patients with ALS, so Lou Gehrig's, significant neurodegenerative diseases, some significant dementia. And so this is very important to get out of your system. It's water soluble, comes out pretty quickly, and the best thing to do for this is an organic diet. This is an example of a stool test. So we can see a lot here. We get a sense of how well you're digesting. So under that intestinal health bar right there, the blue one, we see steatocrit tells us if you're digesting and absorbing fats. Elastase is asking the question, are you making enough digestive enzymes? As we age, we tend to make fewer. Really important to have enough of that so that you're getting all the nutrients from your great diet. There's some inflammatory markers. The secretory IgA tells us a bit about immune function in the gut. Anti-gliadin will tell us if you have a maybe not celiac, but some sort of sensitivity to gluten. Calprotectin, also inflammatory, and zonulin can tell us about leaky gut, in case you've heard of that. And then this is an example of a nutrient panel. So telling us what somebody might need more or less of very specifically so that we can help to replete them of the nutrients that are so important to cognitive function, of course, but also to detox and immune function that are going to support cognitive function. So we're going to move on to question and answer pretty quick here. Start pulling those up. Thank you for your patience with us here. So thank you so much for joining us. I want to make sure you guys have all of the information. Do you want to talk about patients that you're excited to see?
Yes, I'm super excited to see patients. Of course, anybody that is advanced and a caregiver wants to bring them in, we are honored to see them and put them on a protocol that is right for them. We also want to encourage caregivers themselves to screen for dementia and Alzheimer's, because there are statistics that show higher rates of dementia in caregivers themselves. So we want to make sure that you are taking care of yourself as well. So I am excited to work on this protocol for anybody that needs the help. And so our number is right here on the screen. Next steps to becoming a patient, you would just call us if you are a California resident. And if you are out of state, we have the website here for you. This is Dr. Bredesen's website. It's Apollo Health, and there is a link for practitioner locator, and you can look by your state to see who is Bredesen trained that can work with you. I look forward to questions from you. If you have any concerns, any questions, please call this number and we are happy to get back to you with answers, with suggestions, with timelines. If you have questions about when you think you're ready to start a program, if not right now, 6 months from now, as you said already, even a year from now, but just keep in mind that taking care of yourself is super important to you, being able to live a full life and being able to enjoy and spend the time with your family. Yeah.
So anyone from out of the state, we do have patients who fly in to see us. So we, we'd love to see you in person. And since we are licensed, we are medically licensed in the state of California. Anyone who can't make it in person, I highly recommend that you check out Dr. Bredesen's website, apollohealthco.com. And there is a practitioner locator feature there so that you can find someone who's well-trained near you. If you've started the protocol and you're not getting the results that you expected, definitely connect with a Bredesen trained provider. So there's a question here. I'm already on the protocol. Great. Good. You've taken the first step. We work with people who may have Lyme disease or who are considering the removal of amalgams? Yeah, great question. So the order of operations here is typically toxin removal first, because when you have high levels of mercury, mold toxicity, chemical toxins, these things are directly neurotoxic. They're also directly immunotoxic. And so what we've seen is that if you don't have a robust immune system, no matter how many antibiotics you throw at Lyme, whether they're herbal or pharmaceutical, whatever you throw at Lyme, it's not going to go away, not for good anyways, typically, unless you have that robust immune function behind it. So getting the toxins out is step one. So I would recommend doing the amalgam removal. Now, I'm not your doctor, so that's general. There may be other things to consider as you work through this with a provider. And I don't know all of the story, but generally what we would do is we would have the toxins out and then support you in the treating Lyme. And then another question, what are our thoughts about taking NAD to prevent cognitive decline along with the rest of the program? Great question. So what we've noticed is that typically what we want to do, there's different phases, kind of like I was just mentioning with the toxins versus the infections. So phase one is kind of the acute stuff. So we've got to, balance the gut, get the toxins out, get the nervous system kind of under control. NAD is phenomenal for repletion. So but if we have toxins still in the system, that is a challenging thing to be treating at the same time. So NAD is fantastic, especially if you have a history of high stress or a history of traumatic brain injuries. NAD can be very, very, very helpful. So we love an IV NAD. It takes a little while, so you have to set aside, you need to set aside 6 to 8 hours a day for typically 3 days, pretty close together. They don't have to be Monday, Tuesday, Wednesday. It doesn't have to be consecutive days, but if you could do like a Monday, Wednesday, Monday, something pretty tight to get about 3 to 7 grams pretty quickly, that we want to kind of super saturate you with that NAD and push some of those neurotransmitter pathways as well as detox pathways. You want to take the next question?
Yeah. The next question is, what are bioidentical hormones? This is a great question. And what happened in the last few decades is that women were being put on hormones, but they were not bioidentical. They were made from horse urine and they were being administered orally, and those weren't exactly right for the women. And that led to a lot of side effects and things that we do not want to see. So bioidentical hormones are those that are chemically and structurally exactly the same as our body produces. And they're also pretty specific on the form. For instance, progesterone, you would take orally. Estrogen, it would be topical, mostly, not as long as it's not oral. Until a few years ago, they were taking oral estrogen, which is not recommended at all. So, and there is generally a small component of testosterone as well. And then depending on your pregnenolone status, we will see if you need that as well. So bioidentical hormones are basically have been shown over the last several years to help not only with perimenopausal, menopausal symptoms, but also with brain health, with immune health, with your overall health. So we just want to make sure that they are formulated the right way.
And then a good way to get amino acids. So that's such a great question. Amino acids typically come from, so this is protein. So amino acids are the small building blocks of proteins. So of course you can get this from animal protein and then also from plant protein. So legumes, things like lentils, soy, and then beans, rice, anywhere that you think of having protein, whether it's animal protein or plant protein, will have amino acids in it. And then getting a complete amino acid is really what we're after. Those amino acids that you've probably heard of, things like glycine, lysine, isoleucine, the taurine, the carnitine. Yes, carnitine is a great one for mitochondrial health. You've heard of tryptophan. I'm sure 5-HTP can help people get to sleep, also help with mood. These are the backbone of, tyrosine is the backbone of thyroid hormone, as well as dopamine. So these things are directly, really impactful on metabolism and on mood and on cognitive function. So the best way I think to get amino acids in really any nutrient is a non-processed whole foods diet with lots of variety. As much variety as possible. So the mole test.
Yeah, the mole test that we order. So there are two mole tests that are considered very well, rank high on the scale of the utility of mole tests. One is by Great Plains and the other one is by Real Time. And we prefer to use the Real Time mycotoxin test because it tests the mycotoxins that are most commonly seen and are neurotoxic. Great Plains does as well, but Real Time gives us more bang for the buck. So that's the one we use most often.
And we tend to do a provocation. So if the patient that we're seeing, a lot of this is individualized, but if the patient that we're seeing is tolerant to it, then we'll do IV glutathione and then have you collect your urine for a handful of hours afterwards. And we think we get the best results that way. And then we consistently do it that way so that as we look at the progress over time, we're comparing apples to apples.
Yes, and one more thing to add is that you would collect your urine for 6 hours right after, and then send a sample out of that to the company. You have an appointment with me for your mom in a few weeks. Great. I look forward to seeing you. This is the same clinic as Solcere. Yes, we talked about that we are rebranding from North County National Medicine to Solcere with Sol and Cere, meaning either solutions for the brain or light on the brain. Although we are not exclusively brain focused, but the brain health, focusing on brain health means that we are focusing on everything. We are focusing on endocrine health and metabolic health, and all kinds of body systems come under there. So that's our new name.
So cone beam CT, thank you, Lee, for this question. We often refer out to biological dentists, and yes, we think I agree with them. I am not a dentist, so I'm not as privy to a lot of the conversations that they have in their field. However, my understanding from this point is that the cone beam CT is the best way to understand if there could potentially be stealth infections in the mouth. So this is a phenomenal point. I'm so glad that you're bringing it up because I think it's been underappreciated for a long time, the connection between oral health and cognitive health. We know a little bit more about the connection between oral health and cardiovascular health. It's very common to have strokes and heart attacks soon after a dental visit, whether it is it's a cleaning or a dental procedure. And part of that is because the infections or the bacteria in the mouth can get into the bloodstream, and then they can cause more inflammation and even spasms in the blood vessels. So getting ahead of this is very important. If there's a history of many root canals, they can often harbor stealth infections. You don't have to have a pain in your tooth to have a dental infection. So it is important to have a biological dentist or a whole health dentist who is looking at this. if anyone, we ask everyone if they ever see blood in their in the sink after they brush or floss. We ask if you're flossing. If you do anything starting today for your brain health, start flossing at least once a day, brushing at least twice a day. This is so critical. And so if you ever see blood, it's time to go to the dentist. It's time to get back on your routine of taking care of your oral health. And yes, we recommend the cone beam, particularly if we see an elevation, the LPPLA2, that's a marker that we run routinely. And if that's elevated, it kind of gives us a sense that there may be dental infections present. That's a long explanation of yes, of a resounding yes, cone beams and biological dentists on the team.
Okay. Can you trace the causes of depression with your lab tests? This is a really good question. And what it points to is, what are the reasons that somebody has complex chronic illness? So many of the illnesses that we treat have few etiologies. It's kind of like there's these, Dr. Bredesen talks about 36 holes, in the roof, and you have to fix them. But they all can also be kind of encapsulated into just a few categories. So all complex chronic illness, including depression, because that can be drug resistant and can really be debilitating for many people. So what we need to see is kind of follow a similar approach, but what we have to see is, where is that coming from? Many times mold toxicity can manifest as symptoms of depression and anxiety, and you would never think of mold toxicity as causing these symptoms. But we have seen time and again clinically, when somebody gets an exposure, a repeated exposure, that their symptoms of anxiety and depression come back. We had a patient only yesterday, and we were talking to them about this, that we have to make sure that we detox them and remove and they make sure to not be in an environment where these toxins are still present, so that there is room for an accidental exposure, for them to have an accidental exposure, and for that to not set off a whole chain of physiological symptoms. So the answer to your question, Kimberly, is absolutely yes, we can.
So do we prescribe BHRT for our patients? Yes, when it's appropriate. So it's not appropriate for absolutely every single person, but that's part of what we discussed with you at your visit. I am quick to prescribe bioidentical hormone replacement. So BHRT is bioidentical hormone replacement that we've been discussing a little bit. And I am much quicker these days to prescribe more of it and sooner, because of the data associated with dementia. So because we're seeing primarily dementia, I am primarily seeing dementia patients these days, the outcomes are much better for those people who are getting that signaling that's associated with youth, right? The testosterone, estrogen, progesterone, these are signals that tell our brain to make new neurons, new pathways, new connections, new memories. And having enough of that is also essential, as Dr. Sembi was saying, for immune health, for cognitive health, of course, as we've been talking about, also mood, for bones, for heart health. So the breast cancer conversation is nuanced, and that's something we want to have on an individual basis. But for the most part, if somebody is struggling with cognitive decline, then the risk of that progressing is quite high, and we want to treat that aggressively. And BHRT is part of that process. And I think, which mild test? I think that might be mold test. Yes. So the mold test is the real time, or potentially the Great Plains. Cost. So does the $25,000 price we quoted cover a year of visits and labs? Does this figure include the cost for health coaches? This is a phenomenal question. And what we recommend is that people kind of allocate about $25,000 to get through 6 to 12 months. It really, as I hope we've expressed tonight, this is such an individualized process. So some people require IVs, and this, yes, the short answer is yes, that should cover the vast majority of a year. Now, if you have a lot of the money goes to labs. So labs take a huge chunk of this. The first, because we do such comprehensive labs, the first set of labs is about $3,000. And so if we're doing a lot of labs every 12 weeks, then that adds up quickly. And it does, that's not including treatment. So if a lot of your labs are normal, we don't have to repeat them. And then that can keep the cost down. But if mycotoxins are high and heavy metals are high and chemical toxins are high and your nutrients are low and your gut's not balanced, then now we're repeating a lot of labs regularly. And so, I think if $25,000 were set aside, I feel confident we could make a lot of progress. And you could get, the money is probably the easy part, not for everyone. Of course, I don't want to suggest that $25,000 is a small amount of money, but you can't just throw money at that. I think that's more what I want to convey, is that this takes effort. So we are partnered with you, and like I mentioned before, we can give the advice, but you've got to put it to work at home. With the cost kind of perspective, I would not suggest spending any money until you've committed to an organic ketogenic diet, until you've committed to doing more exercise. So make sure that like those foundational things, until you've committed to, setting aside enough time to get adequate sleep. So this $25,000 does include treatment, and it includes supplements, labs, consults, and potentially IVs. It kind of depends on that individual. But yeah, that would be a $25,000 chunk would be for pretty much everything. That's what we budgeted for our study participants. And so, like I mentioned, everybody's a little bit different. And the 80-20 on this is the lifestyle pieces that cost nothing. If there's any other questions, I think we're at the end of the questions. If there are any others, please send them in right now. Otherwise, we'll start to wrap up. Thank you to everyone who has joined us. It's always a pleasure. Thank you for the privilege of spending this evening with you, and for joining us, inviting us on your health journey. We look forward to seeing you in the clinic, and so thank you for your support.
Thank you very much.